Hello, my name is Madhukar Trivedi, and I'm going to be talking about the benefits of self-monitoring your own mental health. Like most major mental health issues, depression is a major mental health challenge. More than 300 million people globally experience depression. If you look at people around you, 1 in 6 will experience depression in their lifetime, and even 1 in 9 will experience it this very year. There has been an increasing rate of depression worldwide, with 18% increase in the past decade. And it is one of the leading causes of disability worldwide. So this is a huge problem globally and nationally. In the US, about 17 million people experience depression. Just by way of comparison, there are 45,000 deaths from suicide in the United States. Life expectancy is reduced by 10 years for people with depression. And the deaths from suicide actually are higher in numbers than deaths from breast cancer. So this is something that we have to really focus on. And unfortunately, we have let it be silent. People don't think about it, don't try to get help for it. Half the people with depression in the United States never get diagnosed. And of those who get diagnosed, half of them don't even get into treatment. So we are really not addressing this problem, even though it is all around us. One tool that we think is important is monitoring, because without monitoring, we often leave it silent and people don't actually think about it, don't remember. It does affect their life tremendously, but they don't connect the dots. So measuring. So imagine a situation where high blood pressure was not measured. Same thing would happen with hypertension. There isn't an easy way to find out somebody has high blood pressure unless you measure it. And we as a society is clearly now in a stage where we are very health conscious. So daily exercise, there are hundreds of apps, there is hundreds of ways people monitor their physical activity daily. We know that physical activity is very helpful, both for physical and mental health. So we do this routinely, and I wear, for example, a Fitbit. A lot of people use some of the other device to monitor their physical activity daily. Same thing with their diet. They carefully monitor what they eat, how they eat, what are the kinds of food they eat. And they are also monitoring how it is helping them progress in terms of their weight, in terms of their body fat, blood pressure, etc. All of these things are fortunately becoming routine. Imagine, I just came back driving from North Carolina. If we didn't have a GPS, I would have eventually made it here, but may not have made it in time, etc. So therefore, monitoring what is going on is essential. How best to do it for each condition varies. For breast cancer, you do mammograms. For weight, obviously, you get on a scale. And mental health becomes another issue that we should be thinking about, because total wellness is not just physical health. So therefore, measuring your body weight, measuring your exercise, getting your blood pressure measured, getting your annual physical is sufficient for physical health, but not sufficient for mental health. So we need to be thinking about both body, mind, and emotions in order to get to full wellness. I think our focus increasingly is on wellness, rather than just talk about deficits and disease, because that is what really improves not only health, but also quality of life and functioning. And therefore, monitoring all the components of health are essential. Why think about self-monitoring? Obviously, for blood pressure, you have to get a blood pressure instrument to measure it. For depression and anxiety and mental wellness, currently, there are no such lab tests or objective tests like that. But we have published, others have published, there is real value in monitoring by rating instruments, so that you go through methodically measuring what you're experiencing on a week-to-week, month-to-month basis. And therefore, monitoring becomes important. We all have seen, and we have published again, that people reporting what kinds of symptoms, what kinds of dysfunction, what kinds of difficulty with quality of life they're experiencing can be something they can easily report. If you're not able to concentrate fully at work for 4 hours a week, you will know, and therefore asking the person and having them report can actually accomplish that. One of the other benefits of self-monitoring is it can actually help with real-time collection so that the tailored feedback can be provided to support and reinforce positive change. If, for example, 4 days in a row, your sleep is affected, then there can be feedback provided so that you improve your sleep hygiene, go to bed at the right time, avoid electronics before going to bed, etc., so that these effects can be actually counteracted right away. It also reveals insights into the dynamics of psychological processes so that it can help you predict relapses. So for example, somebody who's had anxiety disorder or a depressive disorder, if you monitor your symptoms, function, quality of life, in terms of all these itemized rating instruments, just asking somebody how you're doing is not sufficient. So you have to monitor all the symptoms and all the functional outcomes. That monitoring can help you track it, and in the process, it can give you early indicators. The last 2-3 weeks, something is going on. So that may be a harbinger of another relapse, or it can help you monitor response to treatment. Just going back to a doctor once a month or once every 3 months, it doesn't give you a full picture. If you monitor it on a regular basis, when you go back to see the doctor or your counselor, you can report based on what you have done during that period to track the treatment response and reveal to them so they can change the treatment if you're not feeling well. Similarly, this is also allowing us to do real-time recollection rather than asking somebody 2 weeks later, 2 months later, how was the last 3 months? I don't know about all of you, but I can't remember what meal I had 4 days back or a month back. If I had been tracking that on a daily or a weekly basis, then I would be in a much better shape. So therefore, this recall bias can be avoided if you're periodically and regularly monitoring yourself. So what is self-monitoring? Real world context, where and when experiences or behaviors occur. For example, you had a bad Monday, you would be able to document that, and therefore 3 weeks later, if somebody says, how many days in the last 3 weeks did you not feel well, you could have that recorded and identify risk and protective factors in the environment, because you would know that that Monday you had a fight with somebody or something related to that. It also stimulates an active role for you and empowers management of self-health, because then you are keeping track, very similar to what one does for a diet. If you are monitoring what you've been eating, then you can modify it. You become empowered with it. And allows for development of interventions to support the mental health, integrate these into daily life routine. If you're feeling bad on Monday mornings, then you can begin to figure out how best to avoid all the stressors you might experience, or at least develop tools to address those stressors. Because sometimes it's hard to actually totally avoid the stressor, but you can always develop tools to actually monitor and modify your behavior. So what has research shown about all this? So we have done extensive research. My center at UT Southwestern has actually published extensively that self-monitoring tools, when used, are as good as rating instruments that a professional does, because what is happening in my mind and what is my behavior over the last 7 days, I'm the best judge of doing it. So this is self-monitoring tools. They are really very helpful in terms of monitoring, but can also be associated, they are also associated with improvements in these outcomes, because if I know how I'm feeling and monitoring it, then I can get the necessary help. A study for young adults in early stages of depression showed that self-monitoring itself increased their emotional self-awareness, which is the first step to path to continued wellness. It also allows somebody to put in steps, as I mentioned earlier, tools to try to overcome some of these challenges. One other thing is people who have recurrent episodes of depression. Self-monitoring helps them prolong periods between depressive episodes so they could stay symptom-free for longer. And self-monitoring tools also have a motivating effect for people. who've never been treated. So for example, again, same thing with weight. If you measure your weight regularly and you find you've put on 20 pounds, then you will know you need to do something. Same thing with depression, anxiety, fitness, mental fitness, resilience, etc. If you're monitoring it regularly, tracking it, and there is a graphic display, then it gives you tools to say, this is not working, maybe I should get some consultation or go to a medical professional to get an opinion. So why should you track depression symptoms? Really, it applies to many things, but depression symptoms really help you empower yourself to be more aware of these symptoms and behaviors. So awareness, obviously, as we mentioned earlier, is the first step. It also helps you identify trends and engage with resilience prevention, put in protective measures, avoid things that are really affecting you negatively. Capturing this important data can also help you communicate with your healthcare providers so that they can take the necessary steps. If your medication needs to be changed, if your therapy needs to be increased in frequency, that tracking can help the healthcare provider make those decisions. And using tracking as springboard for more informed and collaborative conversations is key. I think what I tell patients all the time and in the general community is that you have to become really well-informed consumers so that you can, when you go to the doctor, you can actually communicate with this and you can empower yourself to get the necessary treatment. Eventually, our goal is to raise and learn and raise awareness so that that group of people that I mentioned at the beginning, that half the people who never get diagnosed, my hope in real world is that we never get there. We don't do that for any other medical illness, and we have been doing it for depression. We need to change it. So this is really a tool that will eventually transform the way we deal with depression, at least in my mind. And it improves your self-management skills. And in the process also helps you establish healthy attitudes and behaviors. So this is really a multifaceted, think of it as a approach to get to wellness and stay mentally well. What if there was a way to measure and monitor our mental and emotional wellness? And in order to do this painlessly so that people can do it easily, like I mentioned, my example of a Fitbit, using the Fitbit helps me keep track so that on weekdays, or for that matter, weeks, I'm not exercising enough. It gives me a dashboard that helps me see this. And this is what we have developed, a tool which is a smartphone-based device, soft application, that is web-based application that is called Evexia. Evexia is derived from the Greek word for wellness, and it is an individual-focused cloud-based screening tool. So this does not require you to log on to, first time you log on, you actually log on to the website, and then you have this on your phone, allows you to monitor your mental health. It tracks your wellness and depression, anxiety symptoms over time. You receive information from us and recommendations to improve your well-being. As I mentioned earlier, if your sleep is impaired for 4 days, then the software will send you messages about what kinds of things you could do. You can see some of that feedback on the right-hand side of this panel for the graphic display. But the graphic display is in itself really self-empowering, because if you look at the yellow graph there, it tells you that there was a period when you're getting worse. At that point, it is best to get some help for that. And when you're getting better, you monitor that and compare that with your past so that you can actually be, again, empowered to be the best consumers for your own health. How do I self-monitor? Again, get in the driver's seat with this. We have, as I mentioned, we have this tool available. It can allow you to access services from home via website. You can complete these self-reports regularly, but the dashboard is, in my view, the most important, and it does allow you to get tips to improve your symptoms, and you can actually even take these reports to your providers. We are in the early phases of this, so we will expand this. But right now, we have several self-report measures that measure health behaviors, social functioning, quality of life, lifestyle, depression symptoms, anxiety. And the dashboard allows you to track these, and the affirmations and recommendations are really driven to improve the quality of life. I think one of the major drawbacks in the current version of how depression is dealt with is it is really designed to help you get over the depression, but doesn't really help you get fully recovered and return to your previous level of functioning. This is, again, an attempt by us to see if we can get there for most patients. This is an example of someone who's been monitoring over time and is showing improvement. And you can see on the right side, there is a graph that you can see that you're getting better from the red to the yellow. Your goal may be to get to blue. And they have been monitoring their symptoms on a monthly basis. You can do it more often, less often, but at least once a month, hopefully at least a couple of times a month is what we recommend, so that you can keep track and not get surprised suddenly. This is a visual of users' progress over time. Again, these are the kinds of things in the future. For example, this person who used this, and that rating that you get in April, May, and June of 2020, or in January of 2021, if you begin to pair this with what was going on in their lives, then that may give them tools in the future so that something similar happening again, they can actually train themselves to either seek help or change their behavior and avoid it so that they're closer to zero in terms of their dysfunction. How often should you use this is always people repeatedly ask, but as I mentioned earlier, at least once or hopefully twice a month. But you can answer questions at any time. So whenever you see significant changes for the better or worse, you can do that rating because it's available to you. And you can submit your measures. And if you don't do it on a regular basis, then the software will send you reminders. You can also set your own reminders and notifications based on the schedule you'd prefer. So there are some people we have who want to do it every week, and we allow, so they can put those notifications, so they get a notification to do this every week. So you can sign up by using the link or QR code, going to Center for Depression Research, depression.org. So it's www.centerfordepression.org. And there is just a little quirk in terms of the phone services. So if you are a Verizon customer, you may not receive the text authentication. So you can always email us at cdrc@upsouthwestern.edu. I'm going to stop here for any questions. Thank you very much.